I would describe my patient care philosophy as educator first. I think that a lot of fear in medicine has to do with this lack of understanding. When you enter a room, the patient has no idea what you're about to say, and as a physician, you really have no idea what background or knowledge they're bringing into a conversation. So I really think it's important to get on the same page. I always say, tell me where you're at so I can meet you there. And then it's really all about educating, really explaining these complex things in a manner in which anyone could understand, I would say is very important to me. I often find that when patients come to me for a diagnosis or for an evaluation, they're very worried because they've used Google or so-and-so had this, or my family or friend have had a similar diagnosis and this was an outcome that they had, and so they're very scared. And I think it's important to individualize the conversation with the patient. You really want to understand where they're at and then start the education process. This is what's going on, this is how I think this will affect you today, tomorrow, the rest of your life. So sometimes that means drawing a picture, sometimes that means using a model, sometimes that means pulling up their pant leg and showing them on their leg themselves. So really individualizing a conversation so that they truly understand what I'm telling them, I think is really important in patient care.